You're watching WKBN 27 First News, where your news comes first.
Welcome back. We are live at 5 tonight with Dr. Michael Sevilla from the Salem Community Hospital. We're talking about heat-related illnesses, and this is not something that impacts just the kids or anything. All of us, we can be impacted by this. So what do we need to be aware of?
Well, the most important thing is we'll be talking about is heat-related illnesses. The first thing is heat cramps, and we see that a lot in kids, especially this time of year as kids are getting ready for their fall sports like football and soccer and that type of thing. The next thing that we look for is heat exhaustion. That's kind of the next step, and we see symptoms of dizziness and headache and nausea.
Okay. And when you're thinking about, you know, kids being out there and playing sports, of course, when we talk about heat stroke, what does that mean? What's happening to the body there? Yeah,
heat stroke is kind of the most severe phase of heat-related illnesses. We see this a lot in elderly, especially in people that do not have central air conditioning. And symptoms can be very severe, including fever and confusion, and in some symptoms, instances, seizures. This is definitely a medical emergency. If anybody recognizes this, should maybe think about calling an ambulance or getting people to the emergency room.
Absolutely. It could be very, very scary. So how do we prevent it?
Well, the most important thing is to recognize these symptoms, especially in kids, especially this time of year, because in kids, symptoms can progress very rapidly. And also to check on the elderly, especially those without central air, because this heat stroke can be very severe, and it carries about a 10% mortality rate, so it can be very severe.
Very serious.
The treatment is it's pretty simple, getting people into cooler environments and hydrating them, but the most important thing is to recognize the symptoms so you can start treatment early enough.
And also, when you mentioned hydrating, and a lot of the athletes, the student athletes, they're trying to drink sports drinks, not just water. Obviously, they want to stay away from the pop and go more towards the water and the sports drinks.
Yeah, kids, always these days, they want to go for the caffeine, they want to go for the quick energy boost. But the most important thing is water. Sports drinks are very important too. So, in this time of year, when they start to get symptoms, to start that treatment early.
Sounds good. Thank you very much, Doctor. We appreciate your insight.
Thank you.
Stay with us. We'll be right back.